beta plays a role in causing the joint damage associated with osteoarthritis. A cyclophenac decreases the synthesis of mediators of inflammation like interleukin-1 beta or IL-1 beta. Thus, a cyclophenac helps in increasing cartilage matrix synthesis and shows chondroprotective effect. A cyclophenac exerts chondroprotective effect as it helps to prevent degradation of cartilage matrix. A cyclophenac inhibits the production of IL-1 beta and IL-6. It increases production of IL-1RA, thus inhibiting IL-1 beta. MMPs, that is, matrix metalloproteinase enzymes, destruct cartilage matrix. 4-hydroxycyclophenac inhibits these enzymes. By inhibiting these enzymes, cartilage matrix degradation is stopped. Nitric oxide also damages cartilage matrix. A cyclophenac reduces the production of nitric oxide, thus prevents. Let's check if you have retained the key points. Here is the clinical pharmacology of a cyclophenac. Here is the composition and pack of arflur CR. Select the pack shot to view an enlarged image of the same. Here are the indications and dosage of arflur CR. Arflur CR dosage for chronic pain and inflammation associated with osteoarthritis, rheumatoid arthritis, or ankylosing spondylitis, and is 200 mg once a day. Let's check if you have retained the key points. Arflur CR is to be promoted to general practitioners, dentists, orthopedicians, consulting physicians, general surgeons, and gynecologists. Here are the direct and indirect competitors of arflur CR. Select the arrows to navigate through the slideshow. Let's look at the advantages of arflur CR over diclofenac. Arflur CR contains a cyclophenac, which has IC50, that is, inhibitory concentration for COX-1 is greater than 100, whereas for diclofenac it is 0.6, which means it inhibits minimum of COX-1, that is, good COX. That will result in minimum adverse effects than diclofenac. IC50, that is, inhibitory concentration for COX-2 for a cyclophenac in arflur CR is 0.8, and that for diclofenac is 0.04. This means that a cyclophenac in arflur CR has a high COX-2 specificity, that is, high efficacy of anti-inflammatory and analgesic action. A cyclophenac in arflur CR produces a lower GI irritation compared to diclofenac. Arflur CR with a cyclophenac decreases pain intensity by 72%, whereas diclofenac decreases pain intensity by only 59%. Arflur CR with a cyclophenac has a lower discontinuity of the therapy than diclofenac. No duodenal damage was seen with a cyclophenac in arflur CR, whereas the same was seen in 20% patients taking diclofenac. The dosage for arflur CR is OD, while that for diclofenac is TID. There is just 1% chance of treatment-related diarrhea in arflur CR, whereas the chance is as high as 6.6% for diclofenac. Arflur CR has a half-life of 4 hours, while diclofenac has a half-life of 1 to 2 hours. Select the button to learn more. Arflur CR has a superior gastrointestinal safety profile of aceclofenac as compared to diclofenac. It decreases the severity of joint tenderness. In rheumatoid arthritis, aceclofenac is comparatively effective and safer than diclofenac. In osteoarthritis, aceclofenac provides better improvement in complete knee movement and reduced pain on movement than diclofenac. Aceclofenac was significantly more effective than diclofenac in improving knee flexion. It provides better improvement in pain intensity and better tolerability with fewer gastrointestinal side effects than diclofenac. Aceclofenac is to be given twice a day as against diclofenac, which is given 3 times a day. Analgesic action of aceclofenac in arflur CR is equipotent to diclofenac and is 11 times greater than that of naproxen. Let's check if you have retained the key points. Here are the unique selling points of arflur CR. Arflur CR can be used as maintenance therapy in patients suffering from osteoarthritis or rheumatoid arthritis. It decreases pain, reduces disease severity, and improves the functional capacity of the knee and flexion in osteoarthritis. Aceclofenac in arflur CR ensures reduction in swelling and Ritchie index or painful joint tenderness in rheumatoid arthritis and also improves morning stiffness and spinal mobility in ankylosing spondylitis. It significantly inhibits IL-1 beta-induced PGE2 productions by human rheumatoid synovial cells, also inhibits IL-6 and TNF-alpha. Arflur CR offers excellent analgesic effect in patients with severe episiotomal pain. Peak plasma concentrations of aceclofenac reach in 1.25 to 3 hours after ingestion. Once-a-day dose of arflur CR ensures round-the-clock pain relief due to superior dissolution profile as shown in the table. Here is the mode of action of aceclofenac. Select play to watch the video. Whenever there is a tissue injury, the phospholipids of the cell membrane get converted to arachidonic acid. Let's check if you have retained the key points. Here is the clinical pharmacology of aciclofenac. Here is the composition and pack of arflur P. Select the pack shot to view an enlarged image of the same. Here are the indications and dosage of arflur P. Arflur P dosage for symptomatic management of acute pain and inflammation in musculoskeletal disorders, post-operative pain, trauma, accidental injury, spondylosis, backache, knee pain, fever, body ache and headache, as well as for dental caries, gingivitis, periodontal disease, sensitive teeth, dental calculus, tooth extraction and root canal treatment is 1 tablet twice a day after food. Let's check if you have retained the key points. Arflur P is to be promoted to general practitioners, dentists, orthopedicians, consulting physicians, general surgeons, ENT specialists, and gynecologists. Here are the direct and indirect competitors of arflur P. Select the arrows to navigate through the slideshow. Let's look at the knockout points of arflur P. Aciclofenac in arflur P has analgesic action equipotent to diclofenac and better than naproxen. It also has better gastrointestinal safety profile than diclofenac. Similarly, it provides better relief in tooth pain than opioid mild analgesic combination. Let's check if you have retained the key points. Here are the unique selling points of arflur P. Arflur P is a powerful combination of aceclofenac and paracetamol for pain and inflammation. It is a synergistic combination ensuring rapid action. Arflur P is a rational combination with valuable multimodal analgesia. It provides greater analgesic and faster action. It is well tolerated with better gastrointestinal tolerability and improved cardiovascular safety. Here is the mode of action of aceclofenac. Select play to watch the video. Whenever there is a tissue injury, the phospholipids of the cell membrane get converted to arachidonic. Here is the mode of action of paracetamol. Select play to watch the video. When cells and tissues are damaged, Let's look at the rationale for the combination aceclofenac and paracetamol. In the treatment of painful, inflammatory and febrile conditions, aceclofenac acts as anti-inflammatory and analgesic, whereas paracetamol acts as analgesic and antipyretic. Thus, the combination relieves pain, fever, and inflammation. Paracetamol offers faster onset of action, whereas aceclofenac provides longer duration of action. Thus, the combination is useful in acute as well as chronic conditions. Paracetamol reduces Pg synthesis in central nervous system, while aceclofenac reduces Pg synthesis peripherally at the site of injury. Thus, the combination in arflur P offers synergistic action. Let's check if you have retained the key points. Here is the clinical pharmacology of aceclofenac. Here is the clinical pharmacology of paracetamol.